Filling the UMF web forms is actually the most important physician task in UMF. This is because the web forms constitute the most important tool to document the doctor-patient interactions, and subsequently, this is exactly what creates the reports of clinical visits, of procedures, operations, nursing tasks, etc. In other words, web forms are the mean to capture all the events that occur in a clinical environment and in clinical activities. Finding the web forms. In order to fill the web forms, you have definitely to select a patient first. You can select a patient either in the landing page, or you will definitely be selecting a patient if you go to his Unified Medical File page. In the landing page, you can access the web forms by selecting the Related Forms menu item on the activity menu of the patient. And if you click on the Related Form menu item, you will see a list of the forms that pertain to this activity. In the list, you can see whether the form is imperative. You can see the title of the form, the author of the form, whether it's in edit and its fill date, and you can see the action where you can click in order to edit or to fill or to lock. Otherwise, you can access the web forms by going to the patient Unified Medical File and finding the activity menu within the activities in progress. Each activity has one activity menu, and you can see that this is the same form that we have seen for this same patient in the landing page menu. If we go to other activities, we will see that the form is different, and we can see that the form can have a red asterisk, which implies that this form is an imperative form and that the activity cannot be closed unless this form has been locked. On the right hand side, we can see this small icon which indicates that this form has not been edited and it's in the initial stage of filling. If we look at other menu of web forms, we see that in this activity, the vital signs web form is an imperative form that has been already locked by the user. That means the user have already signed it off with his PIN. We can see that there is another web form that is under edit and it needs filling, which is called the initial VV visit with ultrasound. Now, let's see what happens if we click one of these web forms. When we click on the menu item that triggers a web form, we see that the web form will open up and we will see the different controls in this form. Let's see the anatomy of a web form and its layout. First, you have the title of the web form and you have the name of the patient, and then you have here a box that is called label or annotation. This text box helps to summarize whatever you have seen in the form, because whatever the text you enter in this box will appear whenever this form is shown in lists. Let's see how we handle a traditional form of subjective, objective, and assessment, which is a classical ESO form. Now, we can click to edit, and we can see that these forms can come either pre-filled or they can come totally blank. If they are coming totally blank, then you have to enter the text that you want to add in order to document your clinical findings. Otherwise, if you have requested that they come pre-filled, then you have to be sure to edit the text in order to reflect the reality of your physical and findings and your clinical examination. For example, in this case, if the patient complains of pain in one leg, then probably we need to modify this and say, for example, in right leg. And then if he does not have a dilated skin veins, we should remove that finding. And if he has an ulcer in the right leg, we should add ulcer in right ankle area. Now, we can click OK, and these findings are already documented in this form, but they are not yet saved. And we will see how we will save them. Now, when we go to document the objective findings, we can here see, as we said before, the multiple findings that we need either to ask the patient in order to document, or we need to remove if they are not existent. Now, let's suppose we have only one perforator, and we say that it's at 10 centimeter and of 5 millimeter in right ankle. Now, here we are mentioning that the patient has gross veins and swelling, and we need to document the measurement of the legs, or we can remove this. And here we can mention that this is a swelling of the right ankle. As I have said before, these screens come pre-filled, or they can come totally blank, and it's up to you to use the pre-filled or the totally blank. It depends on the way you want to practice your clinical documentation. In any of these fields, we can actually right-click on it and add an annotation. For example, we can say finding documented through measuring of distance from medial malleolus. So this helps to add more documentation that is more explanatory to any of the texts that we have entered. We can add a note if we want, and then when we are done, we can put here that this patient has an ulcer in right ankle, because this is the most important finding, and that he needs an ultrasound study. Now we are ready to save this form, and I will just show you back that what we have already entered is there, and we can here say gross veins in right leg anteromedial. And now we want to save this form, but we do not want to lock this form. So we will click on enable save, and then we have a choice. The choice is either to save for later edits or to save and lock. Be careful. If you save and lock here, you have to enter your PIN, and then you have to authenticate, and this then becomes a legal document that cannot be altered. Otherwise, if you're still not sure of what you want to do with this form, then you should save it for later edits by clicking Save for Later Edits. And now this form will be saved for later edits. We can click here to reopen the form. And then if we reopen it, we will see that there is a QR code. Now, this QR code, you can use it with the mobile application to upload any picture and to add this picture or even a recording. Whether it's a video recording or an audio recording, it can be uploaded using your mobile after you scan this QR code, and it will be attached to the form. Now, as you can see, all our changes are still there, and our clinical documentation of the patient findings are all completed. Now we will enable Save Again, and this time we are going to log this form. But before I do that, I will save for later edits to show you something. I will close this form, and then I will show you on the patient UMF page that this form that we have already edited shows that this is under edit and it's not locked, and it has already initially been filled. If we click on it, it will open again, and now this time we can enable save and save and lock, and we will enter the PIN, and then we will authenticate, and now our form will be locked. So we get a message that the form has been locked successfully. If we close it, then again on the menu of this activity we will notice two things. Number one, that the form that we have just locked is locked, and we see the lock sign. And also we notice that there is a new menu item which is called Close Activity. And this appears because the two imperative forms are locked. If one of them is not locked, this menu item will not be there. Now, if we click on our form again, we will open it. But this time, we can do whatever we want, but we cannot save any changes now. We cannot modify this form anymore. So as you can see, once you have locked a form, it becomes an immutable document that you cannot really change anymore.